8 common digestive health mistakes and what research actually shows. That healthy habit you do every morning, it might be destroying your gut. I made these 8 mistakes for 15 years, and science shows millions of people are doing the same thing right now. Stay with me, because what you're about to learn could change everything. Have you ever felt like you're following all the common advice for digestive health, but still experiencing bloating, discomfort, and frustration? You're not alone. Millions of people struggle with similar challenges. I spent over a decade dealing with chronic digestive issues. I tried many popular recommendations, but some approaches that seemed healthy actually didn't work for my individual situation. It wasn't until I worked with healthcare professionals and learned about personalized approaches that things began to improve. Today, we're going to examine 8 common digestive health practices that research suggests may not work for everyone. Some of these approaches might surprise you. If you're ready to understand what current science says about gut health and explore evidence-based strategies, let's dive in. Remember, what works for one person may not work for another. Always work with qualified healthcare providers for personalized guidance. Mistake number 1, assuming all fiber works the same way. Let's start with one of the most misunderstood topics, dietary fiber. We're often told to simply eat more fiber for digestive health. While research consistently shows that adequate fiber intake supports beneficial gut bacteria and digestive function, the type, amount, and timing of fiber matters significantly, especially for individuals with certain digestive conditions. What the research shows? Studies indicate that people with conditions like irritable bowel syndrome, IBS, or inflammatory bowel disease may experience different responses to various fiber types. Some individuals tolerate soluble fiber found in oats, psyllium, and cooked vegetables better than insoluble fiber found in raw vegetables and wheat bran. A more personalized approach. If you have diagnosed digestive issues, work with a registered dietitian to determine which fiber types work best for your specific condition, appropriate fiber amounts for your individual needs, whether gradual introduction helps reduce discomfort, and if cooked vegetables are better tolerated than raw. For some people with active inflammation, healthcare providers may temporarily recommend easily digestible foods while addressing the underlying condition. However, this should only be done under medical supervision with proper nutritional monitoring. Key takeaway: fiber is generally beneficial, but individualization matters. Consult healthcare professionals rather than following generic advice. Mistake number 2, expecting any probiotic to solve everything. The second common misconception is thinking that any probiotic supplement or yogurt will automatically improve gut health. What the research shows? Probiotic effectiveness varies significantly based on specific bacterial strains, colony-forming units, CFU count, storage and manufacturing quality, individual microbiome composition, and the specific condition being addressed. Studies indicate that not all probiotics work for all conditions. Some strains show benefits for specific issues like antibiotic-associated diarrhea or certain IBS subtypes, while others lack strong evidence. Regarding commercial yogurts, many contain added sugars and limited bacterial diversity. Research suggests that fermented foods with live cultures and no added sugar may provide more diverse beneficial bacteria. Evidence-based alternatives to consider with medical guidance: unsweetened grass-fed kefir, it contains multiple bacterial strains, naturally fermented sauerkraut or kimchi, and strain-specific probiotic supplements recommended by your healthcare provider. Important: if you have compromised immune function or serious health conditions, consult your doctor before consuming probiotics, as some populations may face risks. Key takeaway: probiotics aren't one-size-fits-all. Work with healthcare providers to identify appropriate strains and products for your specific needs. Mistake number 3, aggressive colon cleansing practices. The third practice to reconsider is aggressive colon cleansing or colonic irrigation. What the research shows? Studies indicate that these procedures may temporarily remove beneficial gut bacteria, can disrupt electrolyte balance, lack strong evidence for claimed detoxification benefits, and may cause complications in some individuals. Your body has sophisticated, built-in detoxification systems, primarily your liver, kidneys, and digestive tract, that work continuously without requiring aggressive intervention. Evidence-based alternatives. Research suggests supporting natural detoxification through adequate hydration, fiber-rich whole foods as tolerated, regular physical activity, sufficient sleep, and limiting exposure to environmental toxins when possible, and working with healthcare providers if you have specific concerns. Medical perspective. Colonics may be medically indicated in specific situations like pre-surgical bowel preparation, but routine use for detoxification lacks scientific support and may carry risks. Key takeaway: your body's natural systems are remarkably effective. Support them through healthy lifestyle practices rather than aggressive interventions. Mistake number 4. Casual or unnecessary antibiotic use. The fourth issue is the overuse or misuse of antibiotics, one of the most significant factors affecting gut health. What the research shows, antibiotics are life-saving medications that effectively treat bacterial infections. However, studies indicate they also temporarily reduce gut microbiome diversity, may affect beneficial bacteria alongside harmful ones, can contribute to antibiotic resistance when overused, and may have effects that persist for weeks to months. Important clarification: while the gut microbiome is resilient and often recovers over time, some changes may persist. However, this should never discourage you from taking antibiotics when medically necessary. Evidence-based approach. Always take prescribed antibiotics for diagnosed bacterial infections. Antibiotics are essential and appropriate when prescribed by your doctor. They have no effect on viral infections, colds, flu, most sore throats. Discuss concerns about gut microbiome effects with your healthcare provider. Some research suggests certain probiotic strains may help reduce antibiotic-associated diarrhea. Ask your doctor if this is appropriate for you. The balance. The benefits of treating serious bacterial infections far outweigh temporary gut microbiome disruption. Never avoid necessary antibiotics due to gut health concerns, but do discuss appropriate use with your healthcare provider. Key takeaway: antibiotics are crucial medicines when needed. Use them appropriately under medical guidance and discuss any concerns with your doctor. Mistake number 5. Self-treating acid reflux without proper diagnosis. The fifth mistake is self-treating heartburn or acid reflux without understanding the underlying cause. What the research shows, gastroesophageal reflux disease, or GERD, and heartburn have multiple potential causes: lower esophageal sphincter dysfunction, hiatal hernia, delayed gastric emptying, dietary triggers, lifestyle factors, or other medical conditions. The complexity. While stomach acid plays a role, the relationship is more complex than simply too much or too little acid. Some individuals may have normal acid levels but impaired sphincter function. Others may have conditions that increase acid production. Why proper diagnosis matters. Different causes require different treatments. Self-treating without diagnosis may mask symptoms of serious conditions, delay appropriate treatment, not address the root cause, or lead to nutrient deficiencies if acid-reducing medications are used long-term without medical supervision. Evidence-based approach. Consult a gastroenterologist for persistent heartburn more than twice weekly. Get proper diagnostic testing to identify your specific cause. Never stop prescribed medications without medical supervision. Discuss all treatment options with your healthcare provider. Some research suggests certain probiotic strains may help reduce acid-reducing medication side effects, but ask your doctor if this is appropriate for you. Research on acid-reducing medications. Long-term use of proton pump inhibitors, or PPIs, should be medically supervised, as studies suggest potential effects on nutrient absorption and bone health with extended use. However, for many people, these medications are appropriate and beneficial when properly prescribed. Key takeaway: reflux has multiple causes requiring proper medical diagnosis. Work with gastroenterologists rather than self-treating, and never discontinue prescribed medications without medical guidance. Mistake number 6: following extreme dietary restrictions without medical need or professional guidance. The 6th mistake involves following restrictive diets without medical indication or professional guidance. What the research shows, dietary fat is essential for absorbing fat-soluble vitamins A, D, E, and K, hormone production, cell membrane health, gallbladder function and bile release, and feeling satisfied after meals. The gallbladder connection. Research indicates that bile, which releases when you eat fat, helps break down dietary fats, absorb fat-soluble nutrients, and maintain healthy digestive function. Very low-fat diets may reduce bile flow, which some studies suggest could affect digestive efficiency. Important nuance: some medical conditions, like certain gallbladder diseases or pancreatitis, may require fat restriction under medical supervision. This is different from following low-fat diets without medical indication. Evidence-based approach. Include healthy fats from sources like olive oil, avocados, nuts, and fatty fish, unless medically contraindicated. Work with registered dietitians to determine appropriate fat intake for your individual needs. Don't fear healthy fats, they serve important functions. If you have gallbladder issues, work with healthcare providers for appropriate dietary modifications. Key takeaway: healthy fats serve essential functions. Don't restrict them without medical reason, and always work with qualified nutrition professionals for dietary guidance. Mistake number 7: following generic balanced diet advice without personalization. The 7th issue is assuming one dietary pattern works optimally for everyone. What the research shows, individual responses to different macronutrient ratios vary significantly based on genetics and metabolism, activity levels, existing health conditions, gut microbiome composition, and personal tolerance. The carbohydrate question. While carbohydrates are an important energy source, research suggests that refined carbohydrates may affect blood sugar differently than complex carbs. Some individuals with insulin resistance may benefit from lower carb approaches under medical supervision. Fiber-containing carbohydrates support beneficial gut bacteria, and individual tolerance varies widely. Evidence-based approach. Work with registered dietitians to determine optimal macronutrient ratios for your individual needs. Consider factors like activity level, health conditions, and personal response. Focus on food quality, whole foods versus processed, regardless of macronutrient distribution. Monitor how different foods affect your energy, digestion, and overall well-being. Make changes gradually under professional guidance. Key takeaway: balanced means different things for different people. Personalize your approach with professional guidance rather than following generic recommendations. Mistake number 8: consuming concentrated fiber drinks without consideration. The final mistake is consuming large amounts of blended raw vegetables and fruits in concentrated form without considering digestive capacity. What the research shows, while vegetables and fruits are nutritious, consuming them in large concentrated blended form may deliver a sudden large volume of fiber to the digestive system, concentrate natural sugars, bypass the natural pace of eating and chewing, and potentially cause bloating in sensitive individuals. The difference: eating whole vegetables slowly allows for
gradual fiber delivery, proper chewing and enzyme mixing, natural satiety signals, and better blood sugar regulation. Evidence-based approach. If you enjoy smoothies, consider smaller portions. Include protein and healthy fats to slow absorption. Pay attention to how your body responds. Whole foods may be better tolerated by some individuals. And work with dietitians if you have digestive concerns. Important, this doesn't mean vegetables are harmful. They're essential. It's about delivery method and individual tolerance. Key takeaway: food form matters. Pay attention to how your body responds to different preparation methods. This video provides general educational information about digestive health and lifestyle factors. It is not medical advice and does not replace consultation with qualified healthcare professionals, including gastroenterologists and registered dietitians. Always consult your doctor before making any changes to your diet, supplements, or medications, especially if you have diagnosed digestive conditions. Never stop prescribed treatments without medical supervision.